My name is George Dunkerley. I'm the Executive Director of the Pulaarvik Kablu Friendship Center in Rankin Inlet, Nunavut. Unfortunately, I think Tim's left us for today. I'll catch up with him with the poverty meetings next week. We weren't really given an outline as to what we were supposed to speak about this morning other than what's in the agenda. So what I'm going to do is give you a brief history lesson on the Friendship Center and what we do right now and where we plan to go in the future. Our Friendship Center started in 1973, basically as a group of elders sitting around our living room, worried about increasing alcohol problems in our community due to the nickel mine. Over the course of time, in 1979, it was incorporated as a nonprofit charity. We received our charity status from the federal government that year as well. Fast forward in 2003, I started working at the Friendship Center as a part-time bookkeeper. I go there every Wednesday and Thursday just to keep their financial records up to date. I was hired as their finance officer in 2003. At that time, the Friendship Center had 6 programs running and we had 17 staff. We were a relatively small organization that were pretty much ignored by everybody outside of our own community. In November of 2003, I took over as the executive director. Since that time, the Friendship Center has virtually exploded in our quest for more services for our people. Today, we are probably one of the largest service providers in Nunavut. We don't do research per se, outside of talking to our community members as to what services and programs that they'd like to see happen. We take research such as was presented today and use that in our quest for funding from both federal and territorial governments. Today, the Friendship Center is an extremely vibrant organization. We have 77 staff located in 6 communities all over the Kablu. We receive core funding through the Aboriginal Friendship Center program, which was started by the federal government in 1971, I believe. We're this much short of $4 million in revenue this year. Hopefully that'll change by the time I get home. We directly inject $2 million in payroll through our 6 communities, through our staff members. We seek funding for community programs based on the requirements of our individual communities. If somebody in Repulse Bay has a program that they want to see, whether it be a daycare or a counseling program or pretty much whatever the community has decided that there is a need for, they bring those ideas to us, and then it's our job to find the funding and to make sure the programs operate and that we're accountable to all of our funders as well as our communities. A couple of things that were touched on yesterday, we've been working on in Nunavut for quite a while. The largest program being the Homeless Shelter Initiative. In Nunavut, there is no money for homeless shelters. There is one in Iqaluit, but that's where all of the territorial money for homelessness goes. We were offered 2 years ago, they offered us, it was research money basically to identify a need. I've got 3 of those people that are homeless working on staff for me. In Nunavut, it's not so much that we don't have a homeless shelter, we don't have homes. The waiting list for public housing is 3 years long. We have government workers who move to our communities that don't have houses to live in. They get put in with other government workers. The economic development officer who just got hired by our hamlet is living with another hamlet employee because there simply isn't housing in our community to accommodate it right now. Right now we have 18 full-time programs running, and we run social programming, again, based on the wishes of the constituents in our communities. We run prenatal nutrition programming, preschool. I have to read them because I forget what some of them are sometimes. Prenatal nutrition programming, preschool, community daycare, school bus services, a youth program funded by the federal government, residential school counseling programs, community cultural programs, cancer information program, youth addictions, spousal abuse counseling, victims assistance. We have 3 different cultural sewing programs ongoing right now, Inuktitut language classes, children's oral health program, community access program where we put computers in the library and provide internet access for everybody in town. We run a community library, 2 elders committees. We just started with the government of Nunavut to promote an active parenting program where we're actually going to go and teach people how to be parents. Teen pregnancy in Nunavut is ridiculously high. I had a 14-year-old office girl when I was working at the Northern store who was pregnant, and her family was extremely happy about this. And that happens a lot. And we also do conference coordination services for the federal government when they have big conferences anywhere in the country. Especially with Health Canada, they call us. We do all the coordination and make sure everybody gets there, goes to their conferences, and gets home again. So that's who we are. Something quick that I wanted to share with everybody that I just happened to catch on the CBC News when I got up this morning. There was an organization in Ottawa that released a poverty report card, and it was mentioned yesterday. According to this poverty report card, 1 in 10 children in Canada live in poverty. In the Aboriginal world, that's reduced to 1 in 4. From my personal experience, I'd say, especially in Nunavut, it's a lot worse than that. 323,000 families rely on food banks in our country last year. The report called for the federal government to introduce a federal minimum wage, which currently doesn't exist right now. Provincial minimum wages run between $9 and about $10.25 an hour. They're asking for an $11 an hour minimum wage. Increases to child benefits packages for poorer people. According to the survey, fewer than 1 in 5 families have access to daycare spaces. And in Rankin-Inlet, I can attest to that because the number is actually worse. We have approximately 300 children under the age of 5, and we have our daycare holds 21. The last part of the report that I caught on the news this morning listed that there are approximately 750,000 people living in unaffordable or substandard housing. And again, going back to Rankin-Inlet, that's easily identifiable. We have in our community, just as an example, the lady who works as my office supervisor, there's her and her husband and their 4 children. They live with her grandmother and her brother and his wife and their 3 kids in a 2-bedroom house. They literally take turns sleeping because there isn't room for everybody to lay down in one place. The kids sleep at night, get up in the morning, go to school, and then all the older people go and lay down and go to bed. That happens a lot in Nunavut, and it's something that we've been working really hard on, but we don't have any concrete ideas as to how to fix it right now.